Hi friends, today on this video I'm going to talk about the types of cells and their adaptive responses. To know about adaptive responses, first of all we should know about the types of cells in our body. According to the lifetime, there are three types of cells in our body. They are the permanent cells, stable cells and the labile cells. Permanent cells itself, as its name implies, they are permanent. They cannot do mitotic division. Mitotic division is not for permanent cells. They can't divide. They do not form mitotic figures, and the examples for permanent cells are nerve cells, and the ganglion cells surrounding it, and also the cardiac muscles and the skeletal muscles in our body are permanent cells. Once these permanent cells are damaged, if they are not adapted or if they cannot recover to their healthy state, they will be dead forever. But they can be regenerated. That means if the nucleus of the cell is present, they can regenerate. But they can't do mitosis. Stable cells have a long G0 phase. G0 phase is one of phase in the cell cycle. So once they got a long G0 phase, they are stable now they are stable. Okay, now the cell is stable, but when it is stimulated by an extra agent maybe, or an agent inside our body, once this is stimulated, it can undergo mitosis and form new cells. For examples, parenchymal cells, parenchymal cells in our liver. In the liver, let's use another color for it. In the liver, then in kidneys, and also in lungs. These are the lungs. Okay, and another example is mesenchymal cells. They are the osteoblast, endoblast and fibroblasts. As the name implies, the next one, labile cells, are not stable. They are not stable. So they should have opposite actions of the stable cells. Stable cells have a long G0 phase, but labile cells should have a short labile cells, short G0 phase. Therefore, they undergo their cell cycle is completing quickly. Therefore, they undergo mitosis very quickly without it's not happen due to stimulation, but it can be doing fastly during stimulation, but it is always dividing. Examples are the basal cells of the epithelium. In the epithelium, we know that there is a basal layer, and the upcoming layers are formed by the mother cells of this basal layer. So this basal layer is the person where always undergo mitosis and form new cells in its time. And the hematopoietic stem cells in red bone marrow, which produce RBCs. Hair follicular cells, your hair is growing day by day. So these are the hair follicular cells which grow every day in your body. And the germ cells, if this is the uterus, these are the gonads. Inside gonads we can find out germ cells which are dividing. In males, inside the testicles, germ cells are producing, always producing. Okay, now we have a great understanding about types of cells: the permanent cells, stable cells, labile cells. From this, in next slides you will need this one very oftenly. Permanent cells cannot undergo mitosis. Stable cells and labile cells can be undergo mitosis, but stable cells only under stimulation. Let's go to next pages and see what is going on. Yeah, adaptive response. What do you mean by adaptive response? It is adapting according to a response. It is adapting, and adaptation is the response itself given by for certain stimuli. What are these stimuli? Why do these cells? Let's take this cell. Why this cell undergo adaptive response? It is maybe due to a number of cases. Why? Injury. There can be an injury. This injury is caused by noxious stimuli. Noxious stimuli can injure the cells, and also stress. This is the physical stress actually. If we are scratching our hand, the stress is on the cells of our hand. So they undergo stress, so they are going to adapt themselves. Let's see. The next thing is demand. If the body demands something from this cell, we need some more from your cell. So cell will tell, okay, take these things, and they produce for the demand. The cell tell, no, now it is enough. Then cell will say, okay, I will produce less. So that is an adaptation according to the demand. So cells cannot do this thing without any help. So they what they do is, let's use another color. They do number of things. They can undergo hypertrophy. As adaptations, they undergo hypertrophy, maybe atrophy, hyperplasia, metaplasia, dysplasia. These are the adaptive responses in our syllabus. Let's see what these adaptive responses are in clear minds. Okay, now we have, these are the normal cells. As a rough to get a rough understanding, I will tell this. These are the normal cells. Now you have 4 cells here. Okay, 4 cells here. 4 cells at this normal stage. Then after, in atrophy, in this place atrophy is taken place. Therefore, the number 4 remains, and the cells seems like shrunken, weak, and they are degenerating. In hypertrophy, 4 is present, but they are bigger than the normal size, like swollen. In hyperplasia, there are more than 4 cells. 1, 2, 3, 4, 5, 6, 7. So in hyperplasia, number of cells has been increased. But remember, in hypertrophy, it has not increased. In metaplasia, it have number of layers. But these cells, the newly formed cells, look all alike. In dysplasia, we have number of cells, number of layers going to many directions, but see carefully, it have lots of mitotic figures, and the newly formed cells are not all alike. They are different from each other. Okay, now we have a rough understanding about atrophy, hypertrophy, hyperplasia, metaplasia, dysplasia also. Now we are going to talk about them in detail. Firstly, I'd like to choose what? Hypertrophy. Okay, let's go. Hypertrophy is the mechanism of hypertrophy. It has same number of cells and it is becoming bigger. The cells have become bigger and bigger. The reason is, firstly, now I am talking about this picture, how the normal cells came to this place. It's happening. The first thing to happen is gene activation. Gene activation. You already know that gene, after they coded, they can produce proteins. So protein synthesis increases. So the metabolism in the cell increases and organelles are producing. Organelle producing inside the cell. So there are a number of endoplasmic reticulums, mitochondria, Golgi bodies. These Golgi bodies, then after peroxisomes, lysosomes, all of this. Now there is a huge number of organelles than the normal. So the cell and also cytoplasm also increased. Therefore the cell is getting bigger. Now I told that the types of cells will affect the next slides. So in this slide, it is very important that these cells have not undergone mitosis, but the cells in this side, all the way they have undergone mitosis. So this is the only thing. Hypertrophy is the only thing that can done by permanent cells. For permanent cells, it is the hypertrophy that they can only perform. They can't undergo hyperplasia, metaplasia, dysplasia. And also, to reduce the cell size, they can undergo atrophy also. The permanent cells. So the permanent cells, this guy can only cooperate with hypertrophy. Now, these are the guys. The labile cells and the what? Yeah. Stable cells. Stable cells and labile cells, all these two can cooperate with all of these things. They can undergo atrophy, hypertrophy, dysplasia, metaplasia, hyperplasia, anything. But permanent cell can only cooperate with hypertrophy. That is an important point. Let's check what are the examples for hypertrophy. First of all, at first I am going to talk about the physiological examples of hypertrophy. Why physiological examples? There are also pathological conditions that hypertrophy is occurring at. So these are the good aspects. That's why I am presenting a good face here. These are the physiological examples for hypertrophy. This is an athlete. You can see his skeletal muscles undergo hypertrophy because skeletal muscles cannot divide. And the uterus in pregnancy is hypertrophy. It is due to hormonal stimulation, especially due to estrogen. The one who undergo atrophy in uterus is myometrium. Yeah, these are the physiological examples. Now, it is a GIF. Pathological examples for hypertrophy. Pathological means it is bad. This one, the heart muscles can undergo hypertrophy since they are permanent cells. When it is hypertrophied, we call it cardiomegaly. Cardiomegaly can be a result of myocardial infarction or systemic hypertension and aortic valve diseases. In myocardial infarction, in systemic hypertension, aorta is the main blood vessel that pumps blood out of the heart into peripheral organs. During systemic hypertension, an aortic valve disease, maybe stenosis, maybe regurgitation, the blood inside the left ventricular chamber cannot be pumped out of the aorta very easily. Therefore, the demand increases, the energy demand increases. The body is telling the heart, oh, what are you doing? The blood is inside the left ventricle and they are not going out. Just increase your energy. To increase their energy, the only thing they can undergo is hypertrophy. So they undergo hypertrophy and give that demand. If that demand is not given, this person will die. In myocardial infarction, the blood supply to the heart is cut down in any region of the heart. Therefore, the heart muscle cells, the cardiac muscle cells will not receive enough oxygen. Then the body comes and says, hey, what are you doing? You need more contractions. And so the poor cells go hypertrophy. And this is called cardiomegaly. Okay, now the uterus. The uterus, when there is a estrogen tumor, when there is a estrogen secreting tumor inside the uterus or any other place, the estrogen in the blood increases and it stimulates the hypertrophy of the myometrium of uterus. During drug toxicity in the liver, it is hypertrophied, and when one of the kidneys is removed, and now this one, we call this one-sided nephrectomy. During one-sided nephrectomy also, hypertrophy of the remaining kidney occurs. The next one we have to talk about is, now the hypertrophy is done. Now let's go to hyperplasia. 4 cells have divided and became 7 cells. So permanent cells cannot undergo hyperplasia. Why? They can't produce mitotic figures. In hyperplasia, the mechanism happened here is the DNA synthesis. The first thing is DNA synthesis. Then after, histone proteins also synthesized. Histones. Then cells undergo mitosis. The parent cells will give daughter cells, and the daughter cells will give another daughter cells. Likewise, they undergo mitosis. Therefore, this is happening only in labile cells and stable cells. Okay, there are physiological and pathological examples for hyperplasia. Let's see those things. In hyperplasia, the good aspects of hyperplasia. That means the physiological examples of hyperplasia are the breasts during the pregnancy and also during puberty, the breast growth. This breast growth is actually the glandular epithelium. The glandular epithelium is becoming bigger and bigger. Glandular epithelium is the person that undergo hyperplasia. So, hyperplasia is two types. Humoral hyperplasia because these things happen due to hormones. Estrogen, progesterone during puberty and also pregnancy. Hyperplasia occurs due to hormones, therefore we call it humoral. And compensatory hyperplasia. Compensatory hyperplasia occurs for compensating something. When there is a partial hepatectomy, if we remove this lobe of the dysfunctional lobe of the liver, the rest of the liver undergo hyperplasia and compensate that remaining part. Let's go to pathological aspect of hyperplasia. The thyroid. This is the thyroid which can be enlarged in iodine deficiency of the body. It is called as so-called famous goiter. It is. And then this one, skin. And the connective tissues. Skin is also a connective tissue. This is wound healing. What you can see in this GIF is wound healing. Wound healing in connective tissues such as skin may be, bone tissue may be, and also the cartilages in any place of the body. The wound healing occurs due to hyperplasia. And when you considering about skin, I have not a picture. Skin warts is caused. Skin warts is a result of hyperplasia. It is caused due to papilloma virus. Skin warts occur are the wart-like structures. These wart-like structures in the neck maybe and any other place of the body, especially neck. It is more common. And this is benign prostatic hyperplasia, when the prostate, which is related to reproductive gland of male, their prostate undergo hyperplasia. Therefore, the prostate enlarges. When the prostate enlarges, the urethra is blocked here. You can see the urethra is blocked. Therefore, this man is experiencing an uneasiness of urinating. So, what the surgeons do is transurethral prostatectomy. They remove this part of within the prostate. Then this will become as normal. The next thing is hormonal imbalance in females. The uterus undergo hyperplasia, but not the myometrium. It is the endometrium. When we take in the uterus, if this is the uterus, there are 3 layers: perimetrium, myometrium and endometrium. Endometrium is the person who can undergo hyperplasia. Also, the myometrium cannot undergo hyperplasia because they are permanent cells. And this one, the red bone marrow. The red bone marrow hyperplasia is red bone marrow is the place RBC is produced. When red bone marrow hyperplasia occurring, RBCs increase in the blood. Okay, now I am drawing the two friends here, hypertrophy and hyperplasia. This is hypertrophy. Hypertrophy holding a T on his head and smiling. This is hyperplasia who holds P on his head. Now, these two friends, hyperplasia has lots of cells because it has undergone mitosis. These two friends are going to meet the uterus. Okay, this is just example. Now, you know that uterus has 3 layers. The red perimetrium, yellow myometrium and green, the innermost layer, is endometrium. When going to endometrium, this place, they do their task, because hypertrophy and hyperplasia can be occur simultaneously in labile cells and stable cells. But when coming to myometrium, the middle one, there are permanent cells. Permanent cells do not stand for hyperplasia, P into P. They do not incorporate. Therefore, hyperplasia say, no, I can't come with you. The relation breaks and hyperplasia do not come to the myometrium. Hypertrophy say, yes, I'll do it myself. So, hypertrophy goes along to the myometrium without hypertrophy, because hypertrophy, P, cannot incorporate another P, the permanent cells. It is pretty easy, you see. Yeah, this is a nice picture I have got from a China drama. Let's keep. Yeah. Now we have talked about hyperplasia, okay, hypertrophy, okay. Now let's talk about what? Metaplasia. This one, metaplasia. Metaplasia having normal cell layers which are equal in size and type. Let's see the physiological and pathological examples for metaplasia. The mechanism of metaplasia is that when there is an epithelium, see, this is a cuboidal epithelium or maybe a columnar epithelium, but in this figure it is a cuboidal epithelium. Now, this cuboidal epithelium has been replaced by number of cells which are stratified squamous epithelium. So metaplasia actually has different types. It is replacing a cell type by another cell type. Okay, replacing a cell by another cell type. These cells are normal, but their function is lost. the function done by squamous epithelium is not done by this stratified squamous epithelium. Okay, let's have a look where physiologically and pathologically these things occur. These are the good examples, that means physiological examples. Physiological examples for metaplasia. These are the pathological causes of metaplasia, because metaplasia is always not physiological, it is pathological. It is revenge. It is taking care of a stress. Whenever stress is happening, when there is a stress, what happens? It can undergo metaplasia and it can overcome the challenge has been occurred in that place. There are 3 types of metaplasias: squamous metaplasia, mesenchymal metaplasia, and osseous metaplasia. The main one we are going to focus is squamous metaplasia, because it is happening in the epitheliums, and epitheliums are common in our body all the way there. Yeah, this squamous epithelium, in squamous metaplasia, some kind of epithelium is replaced by stratified squamous epithelium. Now there is stratified squamous epithelium behalf of another type of epithelium. In here, during urinary infections, urinary bladder and this urinary tract will change its epithelium into stratified squamous. And the thymus, no, this is wrong. This should be not here. Ignore it. Okay. Now, during chronic gastric acid reflux disease, you know that lower esophageal sphincter is not working as usual. Therefore, it do not lock. This is the normal one. This is a normal esophagus where lower esophageal sphincter is closed. So, gastric acid cannot reflux into esophagus again. But this is an abnormal esophagus, because lower esophageal sphincter is not closed at the times where it should be. So this is called as Barrett's esophagus. Barrett esophagus. This Barrett esophagus let the gastric contents reflux into the esophagus and cause the heartburn and all the things. So when gastric acid is, which is very acidic and harmful for these epitheliums, the columnar epithelium in the lower part of the esophagus is replaced by stratified squamous epithelium to enhance, to overcome this stress. In the gallbladder, when there are gallstones forming, they replace the epithelium. So in these cases, we can find out these abnormalities by taking a sample of this epithelium and look under microscope. Okay, let's go into next one. Mesenchymal metaplasia. It is that when there is a muscle and the muscles, the fibroblasts are replaced by osteoblasts. Therefore, now osteoblasts produce bone over the muscle. So, bone over muscle is called as mesenchymal metaplasia. You can take an X-ray, and this is most probably one of the heads of triceps brachii muscle. The extensor compartment is looking to, it seems like a bone, because bone is over the muscle. Now, osseous metaplasia is the next one. That one is bone tissue is formed on epithelium. This one, it was on the muscle. Osseous metaplasia is on the epithelium. So this is a picture of uterus where it has undergone an ultrasound scan. This is the uterus. This is the shade of the uterus, and here should be the cervix. This should be the cervix. And here, this small slit you can see like a bone is the endometrium. This endometrium is painted by a layer of bone. Now what happens? The morula, no, the fetus cannot be implanted on the endometrium. Why? Because there is osseous covering which is acting like an contraceptive film. Contraceptive method is using like here. So these are the abnormalities where metaplasia is occurring. Let's go to dysplasia. Dysplasia is abnormal. It is always abnormal. Usually they are tumors. What happens in dysplasia is normal cells, stem cells are good, but the newly forming cells, they are abnormal. They have different pleomorphisms. Pleomorphism is different from each other. What do you mean by pleomorphism? It is the type and the size of the cells that are newly formed. So these cells have different pleomorphisms. These cells show pleomorphism. And also there are plenty of mitotic figures which is a clue that they are going to divide again and again, and in dysplasia it loses its polarity. It grows into different directions. In metaplasia there is no loss of polarity, they are normal cells. Dysplasia is not cancerous. Dysplasia is not a cancer, but it may develop into a cancer one day if there is a severe dysplasia. Okay. Now let's look what are these abnormal conditions where dysplasia is happening. Yeah, dysplasia can appear as tumors or cysts at the breast, the female breast. This is a normal breast and this is a breast with dysplasia forming several cysts. And here in the uterus, it is the cervix and also the uterus also can be damaged. It can be a place where dysplasia occurs, and also the cervix. They are not cancerous. They are not cancers. They are tumors, but they can be developed into cancers. This is a tumor in the prostate where dysplasia was occurred. And to remember, this is very easy. Usually I draw uterus like this, and this is the cervix, and ignoring the gender, I'll draw prostate here. So this is for females, this is for males, and these are the breasts. So these are the places simply where dysplasia occurs. Yeah, it is just a hack. Now dysplasia is done, metaplasia is done, hyperplasia is done, hypertrophy is almost done, and now what is remaining is atrophy. This one, atrophy. In atrophy, you can see there are almost 4 cells, but their size is decreased. Further on, these cells may disappear. These cells may disappear from this place. This is called atrophy. Atrophy often happens due to maybe ischemias Ischemic conditions. Let's list out. Ischemia. Ischemic conditions, and then after uh, maybe malnutrition and reactive oxygen species. However, the nutrients are cut to that cells. Therefore, cells getting weaker, older, degenerative, and they will, if the cells cannot recover, they will choose a death path, like maybe apoptosis and the programmed cell deaths. So that is atrophy. Let's look at what are the conditions where atrophy occurs at. There are also physiological and pathological conditions where atrophy taken place. Firstly, let's look at good atrophy. That means good conditions where atrophy is occurring at. This wall picture is about senile atrophy. Senile atrophy. This happens with aging. With aging, the permanent cells undergo atrophy because they can't produce new cells and the existing cells will aging. These are their brains are atrophied and their neuron cells and their muscles are weaker now due to atrophy, and the fat tissue is gone. These are the things that they have loss of dreams. They have lost their dreams and powers. These are the brains of course. Yeah, that is senile atrophy. Then after gonads, after the menopause. After the menopause, not in males because males do not experience the menopause. It is female who undergo menopause. So gonads will atrophy. Then after at puberty, thymus is atrophied because it is the main immune center at the childhood. After building up the immunity, after puberty, we don't need thymus anymore. And why I have drawn a infant here, this one, because before you come into this world as a neonate, as a fetus, before this stage you are a fetus. During fetal age, your thyroglossal tract, portal venous system, ductus arteriosus, and different opposite type of gonads on your pelvis and all those things, they have been atrophied. So atrophy occurs before we birth and also after we birth. There are some pathological things where atrophy occurs. These are pathological things. During renal artery stenosis, blood supply to kidney is lost. Therefore, the kidney is atrophied. In Alzheimer's, this is an Alzheimer brain, and also atherosclerosis also. During atherosclerosis, the blood supply to brain is blocked. Why? Because there is a block somewhere here. Therefore, brain also get atrophied. It is not seemed like a normal brain and it is wasted. In hypopituitarism, in hypopituitarism, gonads get atrophied in both male and female, so they may get infertile. This is after long time bed rest with the cast on. You are not using your muscles. Therefore, muscles are atrophying when they are not used. This is kwashiorkor and marasmus, which is usually so seeing in different countries also. In this, it is the reason for atrophy is malnutrition. In kwashiorkor, it is protein deficient. Protein deficient. In marasmus, all the nutrients are deficient. Why? When there is a protein deficiency, you know, according to who? Sterling laws, the proteins in blood decrease. Therefore, oncotic pressure causes water to expel from the capillaries. Therefore, they have big bellies with the protuberant belly buttons. And they have other abnormalities also. In marasmus, they have all malnutrition. That means proteins, carbohydrate, fats, lipids, all the things are not there. Therefore, the body is very, very thin. Okay, atrophy is also done. Now we have done all these things. So I hope that you have taken something from this video. If so, you can press the like button and subscribe and hope for more videos. Thank you.